hearing yesterday.
Thank you, Mr. Chairman. It was an important hearing, as is this hearing. As President Obama said in his address to the nation last night, this marks the greatest environmental disaster America's ever known. I'm afraid it also has the potential to become one of the worst public health disasters America's ever known if we're not careful. It's been almost 9 years now since the September 11th attacks on the World Trade Center, and we are still seeing repercussions in the form of health effects on first responders and residents who were exposed in the aftermath. The only group for which we have baseline health measures is the firefighters, and we're still, 9 years later, working to cobble together data on impacted populations. We need to learn from our mistakes. We need to establish a registry of workers, volunteers, and residents, capture their baseline health status, and follow that cohort and their offspring over the long term. The gaps in the research on human health effects of oil spills and the use of dispersants are unconscionable. I understand that such gaps exist because there's never been a need for such data, but that's not an excuse for not taking every step possible now to ensure that we collect and monitor relevant data. We also need to make sure of making assumptions, that we don't make assumptions without evidence to back them up. For example, there's a big assumption that because oil on the surface is dangerous and likely to wash up on shore, it's better to use dispersants to push the oil below the water surface. But we do not know what the impact on marine life will be, or whether the combination of oil and dispersants is more toxic than either one alone. And in addition, we need to ensure that the National Institutes of Health has the resources necessary to quickly ramp up research into the health effects of these oil and dispersants. Similarly, we need to ensure that the Food and Drug Administration and the Centers for Disease Control and Prevention have the resources they need to move forward with monitoring the contamination of seafood, as well as for implementing surveillance system and long-term monitoring of the health effects of both workers and residents. I was aghast to learn that although there is a rostering system in place to capture information about workers who may have been exposed to oil and dispersants, we have nothing in place to monitor unofficial volunteers or local residents. And Mr. Chairman, when the Oversight and Investigations Committee was in the Gulf last week, we were horrified to hear from residents that while there is protective equipment on these boats, many of them are being told by BP and its subcontractors not to use the protective equipment for other reasons. If there's one thing we should have learned from September 11th, is that we need to have worker protections and health protections for everybody involved in this cleanup. And we also need to figure out what's happening to the residents and everybody else down there. Otherwise, we're going, as you said, Mr. Chairman, we're going to be seeing health effects for generations to come.
Thank you. You know, if I could just